Welcome back to Ionized Ideas. You've made it to part 3 of our patient care review for radiologic technologists. This is the final stretch of the series, so get comfortable, stay sharp, and let's finish strong. Let's jump right in and wrap up everything you need to know for patient care. What condition allows blood flow between the ventricles? A. Patent ductus arteriosus. B. Coarctation of the aorta. C. Atrial septal defect. D. Ventricular septal defect. Log rolling is used for patients with suspected what? A. Head injury. B. Spinal injury. C. Bowel obstruction. D. Extremity fracture. Which components make up the infection cycle? 1. Reservoir. 2. Host. 3. Transmission. A. 1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. Inspiration elevates which structures? 1. Sternum. 2. Ribs. 3. Diaphragm. A. 1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. What document gives instructions for future medical care? A. Tort. B. Living will. C. Last will and testament. D. Contract. Which method of pouring solutions into a sterile basin is not correct? A. Place the lid on the sterile tray upside down. B. Hold the bottle 6 inches above the basin. C. Clean from the top down. D. Discard the bottle once the bottle is opened. Performing the wrong exam on a patient may result in which charge? A. Assault. B. Battery. C. False imprisonment. D. Defamation. Which are types of inflammatory bowel disease? 1. Ulcerative colitis. 2. Crohn's disease. 3. Intussusception. A. 1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. Which doctrine applies when a patient is injured while fully under another's control? A. Respondit superior. B. Res ipsa loquitur. C. Rule of discovery. D. Patient's Bill of Rights. An IV bottle bag should be placed approximately how high above the vein? A. 12 inches above the level of the vein. B. 18 to 20 inches above the level of the vein. C. 24 inches above the level of the vein. D. 30 inches above the level of the vein. Which diseases require droplet precautions? 1. Rubella. 2. Mumps. 3. Influenza. A. 1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. Protective, neutropenic precautions are required for which? 1. TB. 2. Burns. 3. Leukemia. A. 1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. For a suspected perforated ulcer during a GI series, which contrast should be used? A. A thin barium sulfate suspension. B. A thick barium sulfate suspension. C. Water-soluble iodinated media. D. Oil-based iodinated media. Nitroglycerin is used for what purpose? A. To relieve pain from angina pectoris. B. To prevent a heart attack. C. As a vasoconstrictor. D. To increase blood pressure. A patient with syncope should be placed in which position? A. Dorsal recumbent with head elevated, B. Dorsal recumbent with feet elevated, C. Lateral recumbent, D. Seated with feet supported. The diameter of a needle lumen is called what? A. Bevel, B. Gauge, C. Hub, D. Length. Early signs of anaphylactic shock include which? 1. Dysphagia 2. Palm, sole itching 3. Throat constriction, A. 1 only, B. 2 only, C. 2 and 3 only, D. 1, 2, and 3. A patient reclined with head higher than feet is in what position? A. Trendelenburg, B. Fowler, C. Sims, D. Stenver. What is the normal respiration rate for a healthy adult? A. 5 to 7 breaths per minute, B. 8 to 12 breaths per minute, C. 12 to 20 breaths per minute, D. 20 to 30 breaths per minute. Which drug is a vasopressor used for anaphylaxis or cardiac arrest? A. Nitroglycerin, B. Epinephrine, C. Hydrocortisone, D. Digitoxin. Which are indirect transmission routes? 1. Fomite 2. Vector 3. Secretions, A. 1 only, B. 1 and 2 only, C. 2 and 3 only, D. 1, 2, and 3. Which statement about hand-washing technique is not correct? A. Keep hands and forearms lower than elbows, B. Use paper towels to turn water on, C. Avoid using hand lotions whenever possible, D. Carefully wash all surfaces in between fingers. What instructions should be given after a barium exam? 1. Increase fluids, fiber 2. Stool color changes 3. Call if no BM in 24 hours, A. 1 only, B. 2 only, C. 1 and 3 only, D. 1, 2, and 3. Which instruments are used to assess vital signs? 1. Stethoscope 2. BP cuff 3. Watch, A. 1 only, B. 1 and 2 only, C. 1 and 3 only, D. 1, 2, and 3. What does the abbreviation PC mean? A. TID, B. Heat, CQH, D. PC. Which are signs of inadequate oxygen? 1. Dyspnea 2. Cyanosis 3. Retractions, A. 1 only, B. 1 and 2 only, C. 2 and 3 only, D. 1, 2, and 3. Examples of diverse cultural groups include which? 1. Generational 2. Socioeconomic 3. Handicapped, A. 1 only, B. 1 and 2 only, C. 2 and 3 only, D. 1, 2, and 3. A double contrast B is essential for diagnosing which? 1. Polyps 2. Colitis 3. Diverticulosis, A. 1 only, B. 1 and 2 only, C. 1 and 3 only, D. 1, 2, and 3. Which is an example of subjective patient history? A. The patient appears to have a productive cough, B. The patient has a blood pressure of 130/95 of a millimeter Hg, C. The patient states that she experiences extreme pain in the upright position, D. The patient has a palpable mass in the right upper quadrant of the left breast. Which is not an ideal resource for non-English speaking patients? A. Automated language lines. B. Special dual headset phones. C. A certified interpreter. D. A family member or friend. Which are symptoms of shock? 1. Pallor, weakness. 2. Increased pulse. 3. Fever. A. 1 only. B. 1 and 2 only. C. 1 and 3 only. D. 1, 2, and 3. Which group requires consideration of reduced skin integrity and pain threshold? A. Infants. B. Children. C. Adolescents. D. Geriatric patients. What term means slowing the growth of pathogenic bacteria? A. Antisepsis. B. Disinfection. C. Sterilization. D. Medical asepsis. What is usual preparation before an upper GI exam? A. Nothing by mouth. NPO, 8 hours before the examination. B. Light breakfast only on the morning of the examination. C. Clear fluids only on the morning of the examination. D. 2 ounces of castor oil and enemas until clear. Effective communication involves skill in which areas? 1. Writing. 2. Speaking. 3. Observation. A. 1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. What is the normal creatinine range? A. 0.6 to 1.5 milligrams per deciliter. B. 4.5 to 6 milligrams per deciliter. C. 8 to 25 milligrams per deciliter. D. Up to 50 milligrams per deciliter. What equipment is used to measure blood pressure? 1. Pulse ox. 2. Stethoscope. 3. BP cuff. A. 1 and 2 only. B. 1 and 3 only. C. 2 and 3 only. D. 1, 2, and 3. Which diseases are transmitted through the air? 1. TB. 2. Mumps. 3. Rubella. A. 1 only. B. 1 and 2 only. C. 1 and 3 only. D. 1, 2, and 3. Inspiration causes downward movement of which structure? A. Sternum. B. Ribs. C. Diaphragm. D. Clavicles. Assessment of an infant's physical status should include which? 1. Skin color. 2. Temperature. 3. Consciousness level. A. 1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. And that wraps up our 3-part patient care review series. Thank you so much for watching, for learning, and for staying committed to your growth as a future radiologic technologist. If this series helped you, don't forget to like, share, and subscribe to Ionized Ideas for more RT review content. Drop your questions or topics you want next in the comments. I'm always here to help you level up. See you in the next video. Stay sharp, stay safe, and keep those ionized ideas flowing.